video requests. Runner's knee, IT band friction syndrome. So, how to rehab this. So basically, the IT band attaches here. It's called Gerdy's tubercle, and it's a huge band of fascia that goes from here all the way down. It's a continuation of a muscle called the TFL that's right here, the tensor fascia lata. So when this muscle's tight, it's going to be pulling up on everything. So you can find this muscle by finding your ASIS, which is your most prominent hip bone right here, just underneath the muscle, like right under my hand. It's called the TFL. Now if you're looking at this video, you got a tight TFL, you'll poke it, you can find it right away because it's going to feel uncomfortable. So basically for IT band friction syndrome, runner's knee, you have tight quads. Like things in the front are tight, too much sitting, not enough stretching. So we can release the TFL with a lacrosse ball. So that muscle right here, all you gotta do is lie down on it, and I don't even have IT band friction syndrome or runner's knee, and this feels fantastic. And by fantastic, I mean it's a good pain. I like it, but it might make some people tear up. Doesn't feel the best, but yeah. So yeah, all you gotta do is just roll around on that. Maybe play inward, external rotation. The TFL internally rotates the hips, so if you externally rotate, this is internal, this is external, it'll relax. Do the opposite of the action that a muscle does, and it relaxes the muscle. It's called reciprocal inhibition. So yeah, roll that out with a lacrosse ball, and that'll help. Next up, foam roller, and you're just gonna roll up and down the lateral muscles. So you got your vastus lateralis, your most lateral quad, your rectus femoris that goes into the patellar ligament, and then, well yeah, we'll just start with those two. All you do, same thing, just roll right from the top of the attachment all the way to the bottom. And make sure I'm still in the video. So yeah, it's probably gonna hurt. So you can use a softer foam roller, but I like to use a PVC pipe or a harder foam roller. This one isn't so bad, it's pretty soft. Like, this feels, it's painful. Legs are sensitive, and our quads are tight. Our hip flexors are tight, so yeah, rolling this out and going up and down at least 10 times, spending at least a minute on the TFL with the lacrosse ball. And then next up, get in a lunge position, and we just want to stretch it. Now, normally I'd put the leg up the wall, but if you have IT band friction syndrome, you're probably not going to be able to do that because the hip flexors are very tight. So this stretch right here, just the 90-90 lunge, we just need to learn how to tilt the pelvis. So this is anterior tilt, like if a glass of water is here and I tilt it and it pours out in the front, that's anterior. Posterior tilt is the opposite. So we want a posterior tilt. You can squeeze the glutes too, which is really helpful. And just move forward. And just with that, I feel a really good stretch in the hip flexors. If you do internal rotation, so bringing your foot out and then move forward, you're going to get into that TFL a little more with the stretch. And yeah, squeeze the glute, breathe, and stretch this out. So yeah, just with those, releasing the TFL, opening up the quads, the tight quads, vastus lateralis, rec fem. It's gonna take a lot of pressure off the knee, Gerdy's tubercle, and it's gonna, because the TFL is a continuation, or the IT band is a continuation of the TFL, it's gonna take pressure off of the IT band. It's gonna release, lengthen the muscle, takes pressure off of the fascia that's pulling, so that will help. You can also just sitting like this. If your knees are that tight, like from the ligaments pulling, that can be helpful too. Like, you know where you're at, listen to your body, but really we just want to stretch these tight muscles that go from here to here, that is shortened, and it's pulling and putting so much extra pressure on the knee. So release them, break up the adhesions, break up the soft tissue. This is your friend, this is your friend. Use it, roll it out. The more time you spend doing it, the more success you're gonna have, the better. So do that, and then stretch into this lunge, and do everything for at least a minute. Squeeze the glute, lunge in, get farther, breathe. Every exhale, try to sink a little deeper into your stretch, or you can hold breathing and you feel a little bit of release after 30 seconds, move in farther. And you can do that. The more you do this stretch, the better. We can really never stretch enough, especially muscles like the hip flexors where we're always in a flexed position. We need to do the opposite of where we're always at. So yeah, just doing these will help really take pressure off the knee and really decrease the painful symptoms of your IT band friction syndrome, runner's knee. And with that, you can get back to running pain-free once you just do the work, do the rehab. So yeah. Yeah, there's the video for the knee, runner's knee, IT band friction. So yeah, I'm going to be posting more videos. If you have any requests, I'll gladly make a video for something of your choice. And yeah, love you guys. Like and subscribe.